So to your left is Shirley Kitchen. She is our board president.
Nice to meet you.
Next to her is Wendy Dawson from the
Tony.
Woolpond School
How's it going
District.
today? Good.
Next to her is Jan Suter, who is our treasurer.
Thank you.
Steve Westra, who is our vice president.
Steve.
In the middle with the camera is Craig Warmbold from WBEV
How's it going
here in
today?
town. This is Becky Gluen, who is on my board, but is also the mayor of Beaver Dam. And then you know Dennis from the Wisconsin Association of Free and Charitable Place.
Yeah, thank you.
So I think that encompasses everybody at the table. Really have a seat. And I did prepare a little information for you guys. And I know Dennis included some there for him,
Right.
from him as well. So you know, you can kind of read a little bit about what we're doing and everything else. So.
Yeah. Well, thanks for your time. I appreciate this. And thank goodness for all your good work. The needs are extraordinary. And I guess if I had any initial questions, I mean, I certainly appreciate all the hard work you do as board members and you representing the association. But kind of give me a flavor, and we've heard some of it before, but you represent the area, and especially Dodge County. The level of need, I mean, clearly, I hear it, but you all represent different parts of the community, and I'm real curious how you see it, and especially if you've been here a while, how it has been accelerating the need or not. And so I think that'd be a good place to start. Whoever wants to try that out.
Well, I could start.
Sure.
We're in our 25th year,
Mm-hmm.
and when we began, we were a very small operation, and we only did medical.
Mm-hmm.
And then, as we talked earlier, we have adapted to the needs of the community. So then the next thing that we added was the dental clinics,
Mm-hmm.
which were very much needed, and now most recently the mental health crisis. And we are trying to interact with the schools, but we don't have enough staff or enough means to serve every school in Dodge County.
Right.
So that's going to be that's where we're going.
Yeah, absolutely. And it is, the issue, we're here primarily this week because we're trying to emphasize the issue of dental services across the state. And clearly there is just an extraordinary need. And I always go back to my roots as an educator, and I know some of you are aware of this, but just to get people to apply for free and reduced lunch is hard.
Sure.
Especially in our rural communities, it's a pride thing, and we just can't afford, in any way, monetarily or otherwise, to continue to have people in need and just nothing happen. Although, this organization certainly has taken it to a different level, so I appreciate that. So any other, Mayor, do you have?
We have seen poverty rates, of course, in this area have escalated over the last 10 years.
Mm-hmm.
So that's something that we work with and deal with in all of our services, schools, police, fire, and EMS. So that's definitely an area. So this is critical, and all of our nonprofits that I think we do really well in Dodge County are critical to making it all work. But this is certainly a little niche that we feel is really special here that we can offer to a wide area. And it's just the mental health piece, which we really felt is important and have really grown over the last few years. And so I think the staff here are really cognizant of that and have worked closely with the schools so that we can work with our children in the area. So it's been really important. And the dental piece too is exciting to see that grow.
And I think also one of our big challenges is always funding. And one of the things that we have found over the last couple of years is really being collaborative is how we have to address this. As Church Health Services, we can do so much, but we can do so much more if we can collaborate with community partners. And one of the programs that was funded by the DPI grant was an AOD program with the Woolpond School District. And then when the new budget was signed, we got more funding to be able to continue that program. So, I know the school district would struggle to fund that and hold that themselves, and we would struggle to fund that and conduct that ourselves. But together, we're able to put our heads together to see where we can draw funding, how we can make it fit for both of the organizations and build capacity for both of us to address some of these substance abuse and mental health issues. This particular program is in the junior senior high school. We'd love to be able to offer something similar in younger grades before we're actually dealing with the substance abuse issue. So that might be something that's on the horizon. But funding is always an issue, and I know there are always some state funding opportunities, but one of the challenges that we find as a rural clinic is our collective impact is small, and that is usually the feedback we get when we're denied grant money. And I know with the new biennial budget there was some additional dental money that was going to be made available, and that is one of the grants that we were denied because our collective impact was not large. Percentage-wise, it is large. It impacts a large percentage of our local area, but we don't serve tens of thousands of people like somebody in Milwaukee or Madison might do. So that's one of the issues we have with funding when we're talking about state or even federal funding. And with the mental health, it's the same thing. I know there were some additional monies that might be available for mental health type funding, but that would be a concern for me is how can we stack the deck, so to speak, that would give the small rural clinics the opportunity to play on a level playing field with the larger urban free and charitable clinics or the federally qualified health centers. Because in many ways we are at a disadvantage because the population center we have is nowhere near in comparison to the large urban areas, and we get passed over. So that would be something that I would really love to be looked at, that maybe there's a different sector of grant funding for smaller rural clinics specifically, because we definitely could use that help out here. That would enable us to bring more people on board to help address some of these dental, substance abuse, and mental health issues, and especially with the children that we're seeing. So that is always a concern for us. And I know, as I mentioned, we get a very small percentage of our funding is from any municipality, and that is our local Dodge County Health and Human Services. Everything else is fundraising, Medicaid reimbursements, grants or individual donors. So we're very lucky because we have a very, very supportive community, but we would love to be able to do more, and funding is always at the root of that. So I know Wendy can speak to the impact that it's had on her students to have that program.
And it was almost exactly a year ago. I think I was with you when we announced our first round of grant funds. So we were one of the first round of districts that were selected for mental health funding last year. We were funded again for the next 2 years, so thank you very much for that additional funding and support, as well as receiving an AODA grant this year too. So the one thing about that for us is we had a partnership with Church Health that started just before those grants were released. And I called Thea on the phone and I said, this is what happened. Can you help me with this? And like I am, she's a dreamer, and so if we have the funding to support it, there are great things that we've been able to do within our school district programs by the support of the DPI grants. So as Thea mentioned, we have an AODA program that services our junior senior high students, so we try to do some of the preventative things with them, but then also we're using it as instead of exclusionary discipline. So instead of expelling a student, we can mandate them to work with one of the therapists from Church Health Services. And then our AOD, or our mental health program, has just exploded since we got the grant last year. Last year we were able to serve 75 students within our school buildings to provide mental health services. A vast majority of that population was through Church Health. We have 4 providers that work within our schools right now, and Church Health is our primary partner. And then we ended up with a waiting list. And at the end of the year, I said to Thea, "What can we do? We don't want kids to be on a waiting list for mental health services because they can't afford it." And that's one of the hugest triggers in our school. We're about 40 to 45% free and reduced. Our district is, and those are all the children that Church Health helps see. If it's families that don't have insurance, if they need access to dental and health care, we shepherd them here to this clinic. Our hope in the next year is to get a site clinic actually in one of our school buildings, a Church Health site clinic, to provide medical, dental, vision services to those families that really need it and a community that really needs it. So we thank you.
Yeah, well, no problem. How long you been at Waupun?
This is my 6th year.
6th year. So how do
Since
you?
I left you.
That's right. So how do you view the explosion of need? I mean, to be honest with you, if you look at things from 30,000 feet, that a lot of people do, we have low unemployment, things allegedly look good economically. I just, so how do you look at that and say, how is this happening down here? Is it because it is as the economy in the state seems to be improving, the need for, at least for kids, but I think all sectors of age is becoming much more challenging. So tell me, Wendy, why is this?
Well, I can only answer for what I know, which is our area here in Dodge County, because I actually grew up in this area as well. And I would say part of it comes just from some of the things that are funded by both the state and through DPI. I think hearing about things like grants for mental health, grants for substance abuse, making those funds available to schools has been a little bit of an eye-opener for many communities and many school districts to say, it is here.
Right.
It's not the unspoken, we're not going to talk about this anymore. People being able to speak about mental illness, speak about trauma that has impacted either them or their families or their children, and talking with school staff about the children that are, coming into schools now, and it isn't something like, we're not going to talk about this, we're going to shove it under the rug, has made a big impact on being able to access services and provide services like that. So I think it's not that it wasn't always there, it's just that people weren't talking about it.
That's interesting.
And I think also, we have a lot of employment and we have low unemployment,
Right.
but we don't have a lot of high-paying jobs.
Right.
So for us, a lot of our families are working families, and they
Right.
can be working 2, 3 part-time jobs.
Right.
And that's where getting children into services really impacts them, because they really can be directly having an effect on whether or not they can bring home a living. Because if you've got a child who needs weekly therapy sessions and you have to take time off work to take them to that, drive them into Madison or drive them into Milwaukee to get these services, it's not going to happen. They're going to send their kids to school and hope that the school district can handle whatever problem their child might have that day. And I think that's where having these collaborations, whether it's with school districts, other nonprofits, other organizations, that's really where we shine. And that's really for our community. That's how we're going to have the impact that we need to turn some of these things and have positive outcomes.
Right.
Because we can't. We can all do our little part of it, but unless we join together and have that bigger power, it becomes much harder to do what we need to do for our local area communities.
Yeah. Well, we fought a battle around expanding Medicaid, which
I was just going to go there.
I figured you were, but
Just a little battle, right?
yeah, and we're not giving up on that issue.
Yeah.
It's important for the entire state of Wisconsin, just because we're in kind of an island among other states on this issue, and so we're hoping that we can convince legislators at some point in time that that's the wisest way to start to address all these issues.
So where are you on possibly expanding that pilot program of expanded Medicaid reimbursements that you were doing? That I know Brown County was
you're talking
involved.
about dental?
Yeah, for the dental reimbursements. Yeah, well, dental is important to me,
Yeah.
so of course
Yeah.
I would, I know there was some talk about increasing and expanding that to some other counties. I think Dodge County would be a perfect county for that because of the number of people we have that are living in the federal poverty levels.
So the governor's budget actually had a package of, it was sort of 5-pronged approach to getting at the dental access issues.
Yeah.
We proposed to end the pilot and use that money
more broadly across the state to increase access to dental services. The legislature adopted several of the pieces of those 5 things. One they did not was dental therapists. Other 2 were around increased reimbursement rates for dental providers to try to entice more dentists to come into the program and serve Medicaid beneficiaries. Instead, they maintained the 4-county pilot project. So we will obviously execute on the law that was passed, and we will extend that pilot through this biennium. What we do intend to do, however, is make sure that we do a really strong evaluation to see whether that money spent in 4 counties is the right investment to expand dental access, and we will go from there. But in the meantime, the budget did include $2 million that the governor proposed for increased dental access through the Seal a Smile program and through our oral health program, which supports through grants a variety of clinics around the state. So we look forward to getting that increase out the door as a down payment on more work that we need to do to expand dental access.
If you look at the 100 free and charitable clinics across the state, about 30% of them provide dental services, and correct me if I'm wrong, they're probably the most expensive services.
They are the most
They're the ones
expensive.
that are the most challenging. So
Yes.
many clinics won't venture into dental because they just can't raise the funds to be able to offer that service,
Right.
even
And is
though
that-
it's so dearly needed.
And is that because the folks who end up in your clinics are it's been neglected long enough that it's more expensive care?
We're seeing easily.
And running a dental chair is also expensive.
Yeah.
Well, yes, we
The
would not.
equipment?
Yeah, we would not have gotten into dental if we hadn't been donated 2 full operatories, and those 2 full operatories were about $150,000 of equipment. As a low-cost charitable clinic, I can't afford that. So that's how we found ourselves in it. We knew we wanted to do it. We dedicated an empty space for that, and somebody made a phone call and said, "Hey, we're remodeling our dental clinic. Would you like some equipment?" We really thought we'd get a sterilizer or 2, but they actually donated 2 full operatories, and that's how we started.
Yeah.
But it is an expensive practice. Because you have a lot of disposable supplies; those cost money, and you have a one and done. You have to throw them away. The staff, dentists are not in a position to be as charitable with their time as maybe a medical professional, and so it's very challenging to get them to volunteer. Well, I can't pay $150 or $200 an hour for a dentist. So even though I have a paid dentist, he's making nowhere near market. And that's why I can get a retired dentist, because it gives him some pocket money to add to what he's already doing. So add into that we're in a rural location and we serve low-income people. It's very difficult to get dental professionals here. So that is always going to be a challenge. And then you add on to that the national shortage of dental professionals. So it's like we've got all these strikes against us immediately, but yet we still are providing services. Now, when we have a child, for instance, we had a child who came in this week. He was 7 years old, and every tooth in his mouth was rotted. And so we're pulling teeth. We're having to, send them then to a pediatric specialist because, they've never been to a dentist because their parents have never been to a dentist. It's not uncommon for us to have an adult come in and we have to pull 20 or 23 teeth because they've gone their entire life without seeing a dentist. And so these, unfortunately, are not uncommon. This is our reality. And so, like Dr. Ron was telling you, he would love to spend a lot of time on dental and oral health education, but really he's spending a lot of his time with his hands in the mouth pulling out all of the damage that's been done. And then we hope while we're doing that, we can then give them some more education.
Well, and who wants to come back a second time if that's your first experience, right? I mean, that is a hard sell.
It is, but we have a very high rate of patients who finish their treatment plans. We do a very good job of making sure that they are in no pain and that they're comfortable and that it's reasonable. But what do? You have 20 teeth that have to come out. They have to come out, and many of them broken at the gum line. It is not going to be an easy extraction. But that is what we're
I'm getting a
seeing.
headache just listening to the story.
Just thinking about just one tooth coming out. And that is
downstairs.
Yeah.
Not too many, I hope.
And that really is the reality of what we're doing. The majority of what we're doing is basic dentistry. We're extracting teeth and filling teeth.
Yeah.
And it doesn't seem to matter the age,
Yeah.
whether they're young or older. We're seeing a high rate of dental decay and bad oral health.
Demand is clearly there, because we just can't keep up with the supply.
Yes, our capacity, we're at capacity. So,
Always.
yeah, we are.
Well, thank you very much. How are we doing time-wise? Oh, sorry.
Well, we can sit and talk about this for hours.
Exactly.
Yeah. Well, and thank you all. And,
Thank you.
Thank you for coming. Very
really important work that you do
Excited to be
here.
here.
Lots of counties that you are serving children
Yeah.
and adults from in the dental area. And so I just thank you and thank you for your good work at Waupun. And the school districts are bearing the brunt of this too.
Yes, we do.
Thank you. Appreciate your good
We're
work.
happy to partner with
We're going to continue our effort to bring more money into the system, which will help everybody. So thank you.
Thank you.
Thank you.
Thanks so much.